First of all, let me just thank everybody for coming today and how important this day will be. As you are well aware, concerns over the COVID-19 continue to grow across the state and the nation. And as governor, I have no greater responsibility than to keep all Missourians healthy and safe. In our press conference last night, I said that we had not yet declared a state of emergency, and that my administration would continue to evaluate the situation and consider all options available to provide the necessary resources. After further consideration, following last night's press conference, we have decided that declaring a state of emergency is the next appropriate step to protect public health. So today, March the 13th at 4:30 p.m., I signed Executive Order 20-02 declaring a state of emergency for Missouri. I want to be clear that the declaration has not been made because we feel our current healthcare system is overwhelmed or unprepared. I also want to make it clear that the declaration is not intended to close public schools. Schools should seek the guidance of local health officials when thinking about closing their schools. The purpose of this executive order is to allow more flexibility in utilizing our resources and deploying them around the state where they are most appropriate. By signing this executive order, I am invoking the Missouri State Emergency Operation Plan. This executive order will enable me to waive certain state laws and regulations where necessary and direct state agencies to report any unfair market practices. This will also provide access to up to a combined total of approximately $7 million in state funds beyond the federal funds we expect to receive. In addition to declaring a state of emergency, we are also taking steps to expand our COVID-19 testing capabilities by coordinating with the University of Missouri and Washington University labs. We have shared positive COVID-19 samples with Washington University that will allow them to create a control and conduct testing themselves in the near future. We are also in the process of doing the same with the University of Missouri. This should increase our testing capabilities by thousands here in Missouri. And we greatly appreciate these universities for offering their assistance in addressing COVID-19. Our state lab will also be receiving more tests from the CDC very soon, pushing our capacities to 1,600 patient tests. We know that testing has become a great concern, and I want Missourians to know that we are working with some of the best resources in the state to address this, whether they are public or private resources. As I mentioned before, the primary purpose of this emergency declaration is to provide greater flexibility in allocating our state resources, not because the local health providers feel they are overwhelmed. However, in many of our communications, we have heard concerns over the availability of personal protective equipment for responders outside of healthcare providers. We are also working to address these concerns. We have been in communication with the Missouri Foundation of Health, which has a relationship with many of Missouri's communities and a history of supporting public health. We will be working jointly with them to try and fulfill the needs of PPE in our urban, suburban, and rural areas. We are also in the process of reviewing federal guidance allowing additional flexibility in health insurance coverage and unemployment benefits. We will communicate more on these items as we receive better clarification. Finally, we believe we will have the capability to deploy temporary structures in accordance with coordination with SEMA and the National Guard should the need arise. Again, I want to assure you that we will continue to take all steps necessary to protect the people of this state. As of today, we have had 2 more individuals test presumptive positive for COVID-19 in Missouri. We are currently in the process of making notifications. We have no other details at this time, but we will share them as soon as notifications have been made. As of today, a total of 94 individuals have been tested for COVID-19 in Missouri. 90 of these tests have been negative. We are in daily communications with the Missouri Department of Health and Senior Services, our lead agency here in Missouri. I've been participating in regular briefing calls with Vice President Mike Pence and other governors for updates on the federal level. From the state and local level, I have been holding regular briefing calls with mayors, county commissioners, and emergency personnel from across the state. We knew this was coming, and we are taking every precaution we can. We are actively taking steps to protect those under the state's care. As a precautionary measure, the Missouri Veterans Commission has restricted access to our veterans' homes across the state. Yesterday, the Missouri Department of Corrections announced it is suspending visitors at the state correction facility for the next 30 days. And today, the Missouri Department of Mental Health also restricted visitor access at state mental health facilities. We also know that there will be people traveling and returning home to Missouri. We are aware of this, and we are prepared to handle these situations. We have an excellent healthcare system, equipped and trained professionals, and I am confident that Missouri is well equipped to deal with the coronavirus. However, I want to emphasize that at the end of the day, we are all responsible for our own actions. If you're told to self-quarantine, it is very important to follow those instructions. My administration will continue to evaluate this situation and all options available to provide the necessary resources, and state government will continue to operate and provide services to our citizens. Please know that this situation changes daily. We will continue to be proactive, and we will continue to work closely with federal, state, and local health officials and emergency personnel to provide you with the most accurate and up-to-date information.